Hi, you know me. My name is Dr. Rahman. I'm a OBGYN who now specializes in midlife female care. I tell the story of the Black Women's Health Directory. I tell the story of how it came about. As a gynecologist practicing in Philadelphia, I would repeatedly get asked, where can I find? Well, first I would be asked, are you still delivering babies? And the answer is no. The second question is, where can I find a Black OB? And initially I thought that this was a simple task. All one had to do was either check their provider directory or Google online. And it should be obvious because here we are, meaning we are living in a large metropolis. We're living in Philadelphia, a city with approximately 1.6 million people and multiple healthcare systems. And I personally know that there are Black physicians practicing medicine in a number of different specialties. But it seems that Black people in Philadelphia, or people in general, don't know that they're there, that Black physicians are here. And so the initial inquiries caused me to do my own search, and I went through a number of different sites, and I finally came up with 5 names, and I would give these names to women who were calling, looking for a Black OB. And that was the start of, wouldn't it be nice? Wouldn't it be nice if there was a Black Women's Health Directory where Black women could see who was available to them where they were living. Now, it doesn't necessarily mean that you always go to a Black doctor, but it's always good to know what's available to you so you can truly make a decision about where you want to have your health care or whom you want to provide your health care. And so for that reason, I was involved in establishing the Black Women's Health Directory.com. And the question was, were there no directories before? And I have to say that my initial investigation showed that although there may have been some directories that listed themselves as a directory for Black healthcare providers, either the information was old and dated or incomplete. And so, to make a long story short, they were ineffectual. And so I thought, let's start a Black Women's Health Directory. And initially I thought, let's start it locally. But that very quickly became a national endeavor. And so currently in the Black Women's Health Directory, any Black practicing physician can list their profile in the Black Women's Health Directory. The Black Women's Health Directory initiative has been a 2-part process. The first process has been getting a sufficient number of physicians to list their profiles, because we want it to be a resource where people can actually find what they're looking for. And then we wanted to share this information with the public, and let it be a resource for those who might be looking. It's been a very interesting journey, and I would love to both write and talk about the experience, the surprises, the disappointments, responses from a variety of sources. What did the hospital say? What did the hospital say? What did the insurance company say? What kind of response did we get? I am looking forward to the day when I can compile all of this information and share. But the reason for this podcast, which will be very short, is to say that representation matters. And on a personal note, I had that experience. My mother had to go to the hospital very recently, needed the care of specialists, and this was not a specialty that I was involved in. And so I had questions. And I was able to use the Black Women's Health Directory to reach out to a Black female who was a specialist in this particular field of medicine. And her response was awesome. She made herself available. She talked with myself and my daughter. She offered help in the future if needed. And it was such a relief. And it was such a relief to the family. So, and I feel very fortunate. I feel very fortunate that I'm a physician. I feel very fortunate that I was able to reach out to this physician. I feel very fortunate that there was a Black Women's Health Directory that I could go to. And so I recommit to trying to make this directory as good as it can be. The Black Women's Health Directory.com. I commit to providing it because it is a source of inspiration. We all know that representation matters. It's good. It's inspiring to see us in all different fields of medicine providing care, providing excellence. And so there will be more conversation. There will be more conversations about the Black Women's Health Directory. You can go to the website now, the Black Women's Health Directory.com, and see the providers, the physicians, the dentists, the therapists that have already listed their profile. I encourage you to approach any other Black healthcare professionals who might want to include themselves in this directory. So I say all that to say that on a personal note, I felt the benefit of something that I've always thought was a source of inspiration for us. And I am very grateful on a personal note to have access to the Black Women's Health Directory. Check it out.